or afternoon, depending on where you are. I am Danielle Preisler. I'm the Content Director here at Optimum Healthcare IT. I just wanted to thank everyone for joining today. It should be a great webinar. We have Brian Rosenberg here with us, and he's going to lead us through keeping your ERP system healthy. So we have saved some time also at the end after the presentation for some questions. So if you do have any questions during the session, go ahead and pop those into the questions box, and I will go over those and let Brian know those questions at the end of the session. So without further ado, I'm going to hand it over to you, Brian, to go ahead and get us started.
Great, and thank you everybody who's joining us today. Let me go ahead and just give a quick overview of my background, and I'll go into what the presentation is going to be involving. But I've been working for good or for bad in ERP and healthcare for exactly 20 years now. My first project in ERP in the healthcare industry was my Y2K project. So I have worked with many of the largest healthcare providers around the country, as well as many smaller regional hospitals, and helping them to develop and implement ERP strategy. Also, lots of work around procure to pay, and I'll go a little bit more into some of that area as well as we're talking about different solutions, and a lot of experience and background in process design and process improvement, which I think is an essential part of making any ERP system successful. So we'll talk about this, and I also mentioned, many of you may be customers who worked with Optimum and Epic in the past, and also should mention that I have led a Epic implementation, and so I've some experience and perspective from the clinical side as well. And there's some interesting differences in how ERP and EHRs are approached, and some ways that ERP can learn from and benefit from what's being done in methodology in EHR implementations. And this gives you a quick overview of the types of roles that I've played in projects in the past, to give you some idea of the perspective that I'm coming from, helping with selecting solutions, with strategy around projects, change management and process design, leading projects, and designing shared services, all kinds of different roles that I've worked on over the years in helping organizations to be able to either acquire and implement an ERP package successfully, or to take their ERP and make it more successful for them. And I think, as we go through this, I'm going to here's a quick overview of the goals and the topics we're going to be talking about. This is quite a wide range of different topics. We're going to cover a lot of different area because I want to give you different perspectives on ways that you can make your ERP system more effective and more healthy. And understanding that one of the challenges that probably many of you are dealing with is just limited bandwidth caused because of COVID-19, and understanding that clinical systems are probably getting a lot of attention and priority right now when it comes to IT, but you probably have resource constraints caused by people working from home, probably have resource constraints caused by the elimination of elective surgeries in a lot of markets, and causing financial challenges for your hospitals. And that problem, unfortunately, is getting worse in some states because some jurisdictions have now gone back to removing elective surgeries as a result of the spike in the coronavirus. So you may have situations where you just have a limited resources ability to bring in outside help to best leverage the resources you have, and lots of conflict over what you should be doing with your time. So as a result, in going through this today, I want to provide a lot of perspective on what's easy and what you can be doing to get through it, and to keep your ERP system running most effectively during this key time, as opposed to larger, big strategic initiatives such as replacing your ERP. At this point, you're not able to do that. So some of the things we'll talk about, we'll understand how to keep your system healthy. We'll talk about ERP governance. We're going to talk about upgrades, replacing solutions, overall strategy and options, and how that applies depending on what ERP system you are currently on. We'll talk about reporting and data governance. We'll talk about working with ERP teams remotely, because many of you may be managing ERP teams that are working from home. We'll talk about third-party solutions and how they fit in, and overall how you prioritize projects, and lots of different concepts of projects that might make sense to tackle during this particular time frame. And overall, want to encourage you to ask questions. We're going to cover a wide range of topics. So if you ask questions as we go, it helps me to understand where to focus my time to make it as relevant to you as possible, understanding that everyone's coming into this with different perspectives. Your organizations are different sizes, you're going to be on different ERPs, but feel free to ask, and I'll be monitoring the questions as best I can, and I'll address some of them during the course of the presentation, and some of them a little bit later. But throw a question in while you're thinking about it, because sometimes it's hard to remember what was most important to ask right at the moment. So feel free. All right, so with that, let's go ahead and get started. I think first we should talk a little bit about just generally the state of ERP in our industry, because the reality of it is that there are three solutions that people are adopting and are growing in our space, and they're Oracle, Workday, and Infor. Now, if you look at this historically, Infor, which used to be called Lawson, I'll still call it Lawson probably interchangeably throughout this webinar because it was always Lawson to me, is a solution that's been around for a long time and has had the most significant market share in the past. Oracle had the PeopleSoft product, which is still heavily implemented, which is being maintained by a lot of different organizations, but they're currently selling and implementing their Oracle Cloud ERP solution, which is less often deployed, but is what they're currently selling. And then the new player in the market is Workday, which is rapidly growing the market. It's a very well-funded public company that has been growing and taking market share away from both the other two players. But when you look at this, these are really the three solutions that are available to a hospital. Now, if you are a clinic organization, if you are somebody who's in, maybe a diagnostic lab or something like that, or manufacturing around healthcare, there's different components of healthcare organizations where there might be other players involved. When it comes to hospitals, these are the solutions that people are implementing. And if you're not on one of these solutions, you might be thinking about going to one of these solutions. And if you're on one of these solutions, you might be thinking about going to another one of these solutions. And so part of the overall question that people always ask is, should I replace my ERP? And I'm going to assume for the moment that you're not really interested in taking on a big multi-million-dollar project right at this particular moment, and talk a little bit more about how you keep your ERP system running while you're making that decision. But we'll talk a little bit perspective in terms of when is the right time to replace your system. And this is a little bit of a conflict in that I just suggest you probably don't want to take on the big project, but whether or not you take it on right now, it's important that you take it on at the right time before you're forced to. And I thought this was kind of applicable, that here's the horse and buggy, that if we went with the idea that if it ain't broke, don't fix it, that we would still have a horse and buggy system. So we have to be advancing, I think, is the key concept. And so you don't want to be thinking just in terms of, does my ERP system work for me today, but will it work for me in the future? And if you don't think it's going to work for you in the future, then maybe you don't necessarily want to tackle that right at the moment, but you want to tackle that before it is too late. Which means that even if you know that you should be replacing your ERP, even if you're not prepared to take on that project right at this moment, you should be starting the process of looking at solutions, of understanding your options, of pricing it, of budgeting for it, and be prepared to take that on as soon as resources are available to do that. Because if you don't plan for it, you're going to be behind the 8 ball when the time comes. And in particular, when you look at, depending on what solution you're on today, if you look back at that, if you are currently an Infor customer, you are probably trying to decide now, should I replace my system or should I upgrade it to 11 Cloud Suite, and try and make that decision in that calculus. If you're a PeopleSoft customer right now, you're wondering whether or not Oracle is going to extend the support, which is currently supposed to go through 2030, and you're wondering when you should do that replacement. And I would suggest to you that it is unlikely that they will extend it out further. They've extended it several times, and that I would get ahead of it, meaning that I would not rush to replace it, but I would get ahead of the process and be prepared to move quickly when the time comes. Because what you don't want to do is be under the gun doing an ERP replacement in the second half of the decade. So you want to be looking at, what can I take on now? When can I start that? process, and can I be working towards that over the next several years so that I'm not in a rush to do that ERP implementation and I can get it done well ahead of time. And you may also, if you have one of these solutions, you may be looking at what Workday is doing and understanding, is this the better option? And if you're not on one of those three solutions, then you might be wondering, is my solution going to work for me? Is it moving in the right direction for this industry? Is it going to support hospitals? And wondering whether or not you need to make a change. So when you look at replacing it, you want to be thinking about, what is the lifespan of my solution? If you are on a Infor version 10, you know that you've got a lifespan because it's a sunset date. If you're on PeopleSoft, you know you've got a particular lifespan. And so you know you're up against a clock and you have a certain amount of time to do it. If you don't know when your solution is going to be sunset or whether or not it's going to continue to be supported, you want to start thinking about what the reality likelihood of that is. But also be thinking in terms of, does my solution keep up with my needs? And that our industry is complicated and is changing all the time. And if a solution is not well in tune with what's happening in the healthcare industry, there's much higher risk that as the industry changes, that your solution is not going to be able to accommodate the needs, particularly when we get into areas such as increasing complexity in our supply chains, and particularly when we get into integration with the EHRs and all the reporting that comes out of that. And many of you are probably Epic customers as well. And one thing that you know with Epic, and with Cerner as well, is you know that they're dedicated and focused on the healthcare industry. Your ERP solutions are not dedicated to the healthcare industry. They may have a healthcare practice, but they support a lot of other industries. And so you always want to be looking at, does my solution understand my industry? And is it going to keep up with those changes, understanding that they all support multiple industries? And you want to also be thinking about implementing change, that often ERP replacements are driven by a desire to make change in your organization. And it might be a good time to pair those two together. You want to be thinking about the cost, you want to be thinking about the ROI, your resources, particularly at a challenging time like what we have now, and conflicting priorities that you have. If you're in the middle of an Epic implementation, you might not want to do an ERP implementation at the same time, but you might want to be lining it up and thinking about it, for example. So assuming that this is not where you want to go right now in terms of replacing ERP, that if we look at looking at upgrading, it's really important, regardless of what ERP you're on, to stay current. And this is something that unfortunately a lot of people fall behind on. To whatever extent you've decided to dedicate yourself to that particular ERP solution, dedicate yourself to staying current on it. What's inevitably going to happen if you don't is you're going to call with a bug or a problem, and you're going to be told that's fixed in the next version. You're going to have limited ability to take advantage of the capabilities of the solution that you have, because you're always going to be behind in the functionality from what's available. And it also means that to some extent, it's a little bit unfair to judge your ERP based upon the version you're on if you're on an old version. So being on the latest and greatest helps you to understand how your ERP fits in the marketplace. And it's going to reduce the costs required to support it. It may require a big upgrade, such as I mentioned, making that change from Infor version 10 to Cloud Suite is a big jump that a lot of people have to consider. But staying current allows you to take advantage of it. If you think you're going to replace your ERP, then you probably don't want to do it. But if you're going to stay where you are, you want to stay current. So always make sure that you've got plans and you're factoring into your budgets, to your resource allocations, the intent to continuously upgrade, because upgrading is a continuous thing. And ultimately where the industry is going is where Workday is right now, where you don't get to decide when you upgrade. Everybody gets upgraded at the same time. Everybody's on the same version. And I think that as you see more and more cloud deployments, that's going to be more the direction it's going to be, which in the long term is going to be very healthy for the industry, and everyone's going to be automatically current, but it's going to be a painful process and transition to get there. So in looking at, both of these are components of your ERP strategy, and I thought the appropriate time to talk about ERP governance and how that fits in, because ERP governance is the organization that should be setting and deciding that strategy. What happens is a lot of people will have an ERP governance structure as part of an implementation, but that structure fades away, or maybe they keep it for a while, and in the years to come, it becomes less important. They become less strategic. IT starts to run it exclusively and doesn't have input from the end users, and it becomes less and less effective. But ultimately, every ERP governance structure should have a steering committee that is responsible for making decisions about strategies such as, should we look at another solution? In which case they would go through a software selection process. Should we upgrade? As well as looking at new modules, third-party solutions, other components that will fit into your strategy. Should be an ERP lead in your organization, somebody responsible for your ERP system, regardless of what that role is exactly. And then there should be subcommittees responsible for different components of it, with finance, HR, and supply chain being your core user base, and a technology team, and then a data governance team. And we'll talk a little bit more about data governance in a little bit. So what's the role of that governance group? They should be responsible for establishing the direction and monitoring the industry as a whole, meaning that this team of people should be paying attention to what's happening with Workday, what's happening with PeopleSoft, understanding who the players are in the market, so that when the time comes, you have a better understanding and you're up to date on it. They should be prioritizing problems and issues, looking at third-party solutions, and we'll get more into that in a moment as well. Approving projects, overseeing projects, and ultimately, if you decide it's the time to replace your ERP, this becomes the natural group to be a part of that software selection process. And there's another a webinar that I've done in the past about our recommended software selection methodology, that if you didn't attend that, there's I believe that one is recorded and available, and we also repeat it on a regular basis. And overall, they should be coming up with a comprehensive ERP strategy. What belongs in the ERP is an important part of that. I think that there's increasing conflict between what's ERP and EHR, and I see ERP marketed in a lot of ways as if it is some kind of a clinical solution, talking about things like physician productivity and other things that are reports that theoretically you can get out of an ERP, but it's mostly pass-through data from the EHR anyway. So there's a question of what belongs in the ERP, what should we report out of each? What modules are we going to use? What third-party solutions are we going to use? When do we customize? And everyone's trying to strain customization, but if you're on a system that doesn't have the capabilities to keep up with the industry, you may be in situations where you're forced to customize to meet industry requirements or to meet productivity standards that you need. So the situations and conversations will come up. When do we upgrade? Setting goals and just generally evolving your ERP solution. So that's all part of what your governance committee should be discussing. And I think that sometimes these governance organizations start to become really tactical and focus on a bug or a complaint or a problem, and they lose that strategy, that long-term vision. So make sure that's part of what your ERP governance is. A big part, it should be what they're focused on. So a big question that I get all the time is around third-party solutions, and it's common that in speaking to a CIO or an ERP product owner, that they're concerned that somebody in some department wants to buy or has bought a third-party solution and wants to integrate it with the ERP. And the question always comes up, should we use the ERP functionality for that? And the answer is, it depends on a lot of circumstances. And I think that some people try to have a very blanket policy and say everything should be in the ERP if the ERP doesn't. But that's not always the right answer. And so let's talk a little bit about how you make that decision and what works. First off, obviously, there's the question of, does the ERP do it at all? If it doesn't do it, and it's something that you need, that makes that conversation pretty obvious and easy. But ease of use is a factor too. Sometimes the ERP functionality is just much more labor intensive for the end users, and as a result is not an effective solution. Sometimes integration is challenging, so if the integration is going to be a problem, it's a good reason to do it in the ERP. Reporting could be very similar. Sometimes you don't have good reporting available out of the ERP, and the third-party solution is going to do a better job as well. And one of the questions you always want to ask is, if just because the ERP does it, doesn't necessarily mean it does it well. So you want to be looking at, when you're comparing to a best-in-class solution, maybe you don't need the ERP functionality to get you 100% there to what would be a third-party solution. You probably wanted to get you 80 and 90% there. If there's a big gap in that functionality, then maybe it does make sense to integrate that third-party solution. And there's a lot of different types of solutions that people look at and consider as a part of that strategy. So I'm going to go through these kind of briefly here in terms of some of the different types of solutions and what I see integrated in with ERP versus not. But you look at something like time and attendance is probably one of the largest scales that you see that all the time outside of ERP. Most ERP systems can do it, but most healthcare organizations are going to be using something like a Kronos to do time and attendance. Why? Because there's a lot of functionality, a lot of needs in our industry with nurses and with unions and with shift differentials and all these things that that the ERPs don't handle as well as some of the big solutions like Kronos do. So you'll have situations like that where it makes sense to integrate. But if you just looked at it from the perspective of does my ERP do it, probably your ERP does do time and attendance. Expense reporting, very similar situation in that that there's big industry players, and Concur is the biggest in the market in that space. And so maybe it makes sense to use something like that. Again, your ERP probably has something, but it probably isn't as effective as some of the third-party solutions in the market. So these are considerations that you want to be factoring in. A good example in the case of expense reporting is that the solution like Concur can do booking and tracking of all of that. Many of the ERPs don't do that. So there's going to be decision points that might help you to decide where it fits. But I wouldn't feel like you have to put something in your ERP just because the ERP has it. I'd really look at it from the perspective of what adds the most value, and is the value that a third-party solution adds outweighed by the additional support or integration burden that may come out of it. And it's important that IT departments go into that with a very open and honest perspective and not just say, well, we just want to maintain everything in ERP. That's not always the best answer. The other solutions here you just mentioned briefly, things like document imaging are usually third party. There's a variety of them listed here. What I want to focus on here on the right side is when you look at contract management, strategic sourcing, and requisitioning, that these are areas that I've seen significant growth in third-party usage. And part of this has been a response to the fact that in the supply chain area in particular, the ERPs have not done as effective of a job of keeping up with all the changing needs of the industry and the need for us to really crack down on spend. And there's a lot of third-party solutions like an Ariba or a Coupa that have grown tremendously in market share because they provided strong solutions that have great user experiences that can bolt into the ERP system. There's a lot of complexity around doing those implementations, and it's a big decision to do that. But I just want to mention that that is a growing trend, and I don't think that that is a trend that's likely to change in the short term. So if you do hear from supply chain departments that we want to look at these kinds of solutions, that's not unusual. And there's a whole different conversation that would go into whether or not that's an appropriate change for your organization. And there's a variety of others here that are mentioned. So, so overall, I would just recommend taking a really good look at how these solutions fit in with that overall strategy. Licensing is something when you, in terms of, here's a great example of something where you probably wouldn't mind some ways to reduce costs right now. Looking at your licensing is an important component of what you should be doing at least once a year. What are you paying for? What licenses are wasted? And what happens inevitably as part of ERP sales, and that's something I talk about in software selection, is there's a little bit of a throw everything in but the kitchen sink at the end to sign the deal that comes out in the process. And you end up getting a lot of modules that are for reduced costs, but you pay support on them. And sometimes that support's paid at a higher cost, but it's not uncommon that you end up buying a bunch of modules that you theoretically will implement in phase 2. The problem is that phase 2 doesn't always come, and you might be paying for licenses for things right now that you're not using. So it's important to look at your ERP contracts and to take advantage of the opportunity to try to cut off some of those additional support fees. And you will often get a response where they'll offer you some kind of discount, or they'll try to get you to keep those licenses because whoever's responsible for taking care of you as a customer does not want to lose that license revenue. So it's important to them to keep you happy. So if there's things you're not using, pushback, challenge, and you probably will find that they'll work with you to reduce the cost, if not take it off completely. And that can be a good way to drop down some of your overall costs. When you look at, we talked about all these third-party solutions and some of the complexity that comes out of that. It's important also to have perspective that you want to make sure that you've got a clear architecture map where you understand how everything integrates. And it's not uncommon when I do an ERP assessment that I ask a list of all the systems that touch the ERP, and we have to think it through with it. We have to start whiteboarding it out, talking about what do you use for this, what do you use for that. Every organization should have an architecture map that should go around their EHR and their ERP, which is really your two central systems, right? Most of your third-party solutions are going to touch one of those two systems. So having an architecture map for ERP that shows everything that comes in and out of it, every system that it touches, is really important to understanding both your current situation as well as what would be involved in making a change. And that change could be an upgrade, or that change could be a replacement. So keeping that up to date is really important, and somebody should be responsible for that. Your organization should have somebody who keeps maps of system architecture. Maybe this is the ERP owner, maybe this is a particular person on the ERP team, but it's important to keep that up to date and constantly be making sure that it's accurate so that you are able to see everything that's touching on that ERP. If you don't have this, this is not unusual. So it's something that I regularly see as a problem, but I would strongly recommend that if you don't have it, you take time to do it. And if you do have it, I would just recommend taking it off the shelf and taking a look at it and making sure it's accurate, and establishing a clear, responsible party to keep it up to date. We talked a little bit before about governance, so I want to shift that over to data governance for a minute. Because data governance is an area that is increasingly challenging, and I think that there's also some confusion about really what the role of a data governance team should be. But the goal of your data governance should be to get your data to key decision makers timely and accurate. That really kind of sums it up. And making sure that the right people have the right information to be able to drive decisions. But the problem is that what the right information is can be up to interpretation. And when you have these robust reporting systems that allow people to run queries, it's not uncommon that people will come up with different results for the same question. And it's not uncommon that the results they come up with will somehow help them to make their case. So there's a quote that there's lies, there's damn lies, and there's statistics, right? So you can come up with any number you want to by reporting on the right way out of your ERP system. So part of data governance rules is to define standards about how data works. So other things like security and data ownership, that's a part of that. And consistency is really the key, though, a key point that we want to get across. So your data governance group should include data stewards, the people who are going to be using that data, the data analysts, the people who are going to be cleansing and maintaining it, the custodians, people like the people who maintain your master files, for example, your item file, your vendor file. These are people who are critical to the way that our data works. And overall, this data governance team should be responsible for making sure we have clear definition of all the key performance indicators that we're going to use. That doesn't mean, and I think that one of the challenges is that when a data governance team becomes a team that basically is just vetting reports, it loses its strategic value. There's lots and lots of reports that solutions have. There's lots of ways you can run reports. But anything official, anything that we're going to report, that we're going to make decisions off of, that's going to go to leadership, should have a clear definition and a clear way we go about getting that information. Let people run reports all they want to analyze and dig into the why is the number what it is, because they should have that capability, but making sure that we understand that the numbers that we're using to drive business decisions have been produced properly and produced consistently. So if you don't have a data governance group, this is something that you should be prioritizing. This will apply regardless of what ERP you have. So even if you're going to replace your ERP, all of this is equally applicable. And those definitions apply when you switch over as well. So all things to consider as part of that. And when you're looking at the results of that, there should be reports that we use to reports to things like listings of stuff. actions we need to take, activities we need to do, information we need to research, as opposed to key performance indicators or KPIs, which are there to measure the success of your operations. And data governance should always be defining those KPIs and making sure they're consistently applied in the organization. So having that group establish a definition, establish a data source to make sure you're always getting the same information is important. And part of that is you want to take that information and use it to establish goals. And your KPIs should include both referred to as leading indicators and lagging indicators. And the difference between that is a leading indicator, I'll flip that actually, talk about the lagging first, because most indicators are lagging. So lagging indicators tell us about what happened before. Most obvious example of a lagging indicator is a profit and loss statement. That we can see the last month we lost money or we made money. Our department hit its targets or it didn't hit its targets. That's good information to have, but you can't do anything about what happened last month. A leading indicator is an indicator that tells us information about what's happening right now in time for us to act upon it. So it could be admissions into the hospital today. It could be something like our purchases that we made today, so that we can use that information to drive decisions tomorrow, so that we have the opportunity to come in under budget. So the more information you can provide as leading indicators, the better. And I would suggest that for every goal that you have, that you establish a leading and a lagging indicator to tie to it, and make sure that people are able to take action in time. And so as you're defining your reporting and your data governance and the indicators that are a part of it, make sure that you're including leading indicators. And if you don't know how to get those to people, that's a great discussion item for a data governance strategy session. Because again, data governance is all about how do we get the right information to people on a timely basis. And tied to that, part of the objective of these KPIs is to establish goals. And something I talk about a lot in process improvement sessions is the concept of SMART goals. Having goals that are measurable, actionable, realistic, and specific, meaning that it can't be a goal that I want to come in under budget this month. The goal should be I'm going to come in 10% under budget. That's specific. That means I can look at it and I can say, did I achieve it or not? And if not, by how much? You can't just have a goal to say I'm going to reduce personnel expenses. It should be I'm going to reduce it by 15%. We want to make sure it's realistic. We want to make sure it's timely. And your data governance organization needs to make sure that the KPIs are available to measure whether or not we've achieved these goals. And goals should have a waterfall effect where they start from the top, work their way down, where the top defines goals for the organization, and then each department assigns goals for themselves that tie in to the organizational goals. So important to make sure both that you have goals defined, and this is a great example of the kind of thing you can do that doesn't have to cost anything during COVID-19 to establish those goals, and to make sure you have reporting and metrics that tie to whether or not those goals have been achieved. And related to that is the concept of process optimization. And I'm a big believer in the concept of continuous improvements, the idea that a process is never perfect. That's fundamentally the concept of Six Sigma. When you look at Lean and Six Sigma, Lean is focused on the idea of speed. How do we make a process more efficient? Six Sigma is focused on how do we make a process more effective so that it's stable, accurate, predictable outcome. So combining the two, the concept of Lean Six Sigma says that we want to make a process efficient and we want to make it stable and accurate. But Six Sigma speaks to the idea that you never are perfect. So you move in closer and closer to perfection over time. The processes always need improvement. Now, you don't have time to improve every process. So part of a Six Sigma project would be looking at what problems are most significant to the organization and how do we make improvements in those processes. When you look at the chart over on the right, shows how this process works where you identify a problem, you look at it, you decide, you develop a solution, you pilot that solution, and then if that solution is effective, you expand upon and roll it out. And if it's not effective, then you try something else. And the concept of building this continuous improvement culture in your organization should be really critical to getting the value out of all of your systems, not just ERP. Some people go down the path of having Six Sigma teams in the organization. I don't think you necessarily need to have a team. Sometimes it's helpful. It's more of a philosophy and methodology that everybody should be following. So teaching everybody the concepts of continuous improvement can help you to drive more value out of any system you have, as well as, in many cases, allow you to make improvements without significant costs, because they don't always have to tie to implementing a new software solution. And this just shows that one of the concepts in Six Sigma is the idea of a KAIZEN event or KAIZEN BLITZ. And KAIZEN is actually a Japanese word that translates to change is good. So it's the idea that we want to try new things. And this concept of a KAIZEN BLITZ, I think, is a great way to solve problems where you take a team of people. Let's take invoice matching, for example, because that's a common pain point in healthcare ERP. We get AP, we get supply chain and contracting, get them all in a room together, map out the problems, work through some potential solutions, get everyone to agree to them. We try one of those solutions, we measure the result, and if it's effective, we expand it. If it's not effective, we try something else. And establishing that mindset can help you to drive significant improvements in ERP operations at minimal cost. Yes, you have to dedicate some time. It doesn't necessarily have to be as long as what's displayed here, but you have to dedicate some time. You can't do this in 1 hour meeting increments. You've got to take more of a retreat format. And that also can be done virtually, through Zoom meetings or whatever tools that you use as well. Another thing that I want to mention is the concept that, that I think one of the challenges that a lot of ERP solutions have is that they stop training after the implementation's over. And understand that training never ends in any modern solution. So you want to be looking at how do you train new hires. Processes break down when somebody stops doing it the way that you intended it to be done, and then they teach somebody else, and the intended results and the intended process just gets filtered over time. And what you find is that whatever the process documentation says doesn't match up with what anybody actually does. So training people properly is really important. Train new hires, but do advanced training. Things like lunch and learns is a great way to say, get people together to share ideas about how they produce reports or what they find is the most effective way to do a particular process. So you want to make sure you're constantly training and doing these advanced training sessions. It's funny I mentioned lunch and learns when probably a lot of your folks are working remotely, that lunch may be over the Zoom meeting, but still the idea of sharing advanced training on a particular topic to make sure people's knowledge is up to base really helps to extend the life of your ERP. It's too often people don't appreciate the ERP and they want to replace it just because they're not using what they have as effectively as they could. So we'll take a minute just to talk a little bit about managing your ERP team remotely, because some of you might be in a situation where all or some of your ERP team is working from home. And having the right tools is absolutely essential to making that successful. And when you look at the different types of collaboration tools, there's a wide variety of things that are available. And obviously things like webinars like we're in right now, video conferencing, which many people have adopted, but having collaboration software, something like a Microsoft Teams or Slack that allows you to be able to share tasks and responsibilities can be really essential to keeping a team running effectively remotely. What I really want to mention here, just because I find that from a support perspective just is not used enough, is instant messaging. And in terms of providing support to your end users, instant messaging is a great way through a live chat service to provide immediate support to end users to make them feel more comfortable. One of the concerns that your end users may have if your ERP support team is working remotely is somebody actually checking my support tickets and getting back to me? If someone is available immediately to help them, that is extremely impressive. It provides great support, gives them increased confidence, and helps to solve their problem quickly. So that's an important component of what you should be including in your solution. And overall project management tools as you have projects running out, which could be something like a Microsoft project, but what you're increasingly seeing people do is you use more of these tools that other more modern project management tools as well as tools such as Slack to be able to track progress and tasks. So make sure you have the right selection of tools, and many of these are not expensive. Microsoft has done an amazing job with Teams rollout and providing a great solution that ties a lot of these things together. One of the other challenges you're going to have is motivating your team during this time period, and I'd make sure that you're focused on communication, both with them and to encourage them to communicate with other people. Again, when you look back at one of the challenges that people are going to have with ERP support is if they aren't getting a response, and at the same time they don't see anybody, they're going to immediately make the assumption that nobody's working. So encouraging your team to proactively communicate more often with end users than ever before, checking in with them, with your major users if you haven't heard from them in a while, and following up on support tickets regularly, even if it's just to tell somebody that you're still working on it, becomes even more important in that remote environment. Having regular check-ins with your team, interactive meetings. I would encourage your teams to do video calls with end users as much as possible. Again, having that regular contact is absolutely critical. And providing them with positive feedback as well, that it's easy for people to feel isolated working from home. It's easy for people to feel unappreciated. So providing that positive feedback to your team members when they do something well is even more important when they're working remotely than ever before. So all things just to think about, and part of that, the water cooler part is something that we all have lost when we're working from home, the idea of being able to just talk about what you watched on TV last night and the weather and all these things. So having team meetings should include just catching up with people and making sure that they're doing all right and giving them the opportunity to have some social time. It should just be part of how you're planning your time. And being available to your team members is really critical. And overall, when you look at where this is going with remote teams, I think that there has been an increased trend towards outsourcing of support, both overseas as well as within the United States. And that trend is going to continue. But what we're seeing is that increasingly people are finding a way to work effectively remotely and to do support effectively remotely from their homes. And it means it can be very positive for a lot of organizations. So one of the biggest challenges that I see that people have with maintaining their ERP systems is that they don't have the local talent that they need to be able to do that job. It's hard to find people. You've got very limited people with experience. If we allow that barrier to be removed of the location they're working from, and we allow people to work remotely, it's going to open up a lot of doors to the possible people who can help to support you. And as long as you're effectively managing those teams, they can bring skills and experience to the table that might not be available in your local market, or they might not be willing to relocate to your market. So I think that as we look at the adjustment in the new normal, it's going to become less important where somebody is physically. And you might as well start using this opportunity to make that adjustment now. So as you're thinking about if you've lost somebody on your team, a replacement, you should be asking yourself, is it necessary for that person to be here in the hospital or with the rest of the IT department? And many of you probably have IT departments that are off-site from the hospitals anyway. So is this really going to be a difference as long as that person is able to effectively work remotely and you have the proper tools in place? Last thing I just want to touch on before opening up for questions is the idea of supply chain. Because when you look at areas where we can achieve savings, supply chain really stands out. And as an industry, I think we are not necessarily holding up our end of the bargain here. Hospitals, so this is a study from Modern Healthcare, at $25.4 billion is the unrealized supply chain savings opportunity. And that comes to 17.7% of the average supply chain spend, meaning that you should be able to, with proper focus, reduce your supply chain spend by 17.7%. That's a huge dollar amount. And that's the equivalent, when you look at this overall, for the average hospital, it's equivalent to the annual salary of 160 nurses, 42 primary care physicians. This is a lot of money. And if we can find those supply chain savings, we can free up money to allow us to hire more people, to allow us to be able to build more beds, to build more ICUs, which many people are trying to do now, and get more modern equipment, pay for PPE, which I know is a challenge for many hospitals right now. So establishing that can be really important. And there's a variety of projects that you can do that I just want to put on your radar to help you with that. There's looking at your inventory, how you're using your space, how you're handling preference items, overstocking and understocking, uh, contingency planning. And I think that, PPE is a whole discussion in and of itself, but we've identified that as an industry, we didn't do a very good job of planning for something like what's happened. And certainly the extent of this, perhaps no one could have predicted. But after the bird flu, a lot of hospitals had tremendous amount of supply of PPE that ultimately got tossed because it never got used. We could do a better job of predicting and planning for these kinds of situations. Keeping your inventory accurate is really important. That a lot of times people find that the inventory they expect to be there is not there. And when you look at, from a purchasing perspective, looking at stock analysis is a project you can do. Controlling your operating room inventory is a great opportunity. And when you look at with optional surgeries off the table, for a lot of organizations, it's a good time to get a hand on your OR inventory. Expiring inventory is a big challenge in our industry and something else that it's a good time to do that. Scanning, cycle counting, a variety of other things. So it's just examples of projects that are good to take on during this kind of situation because they're going to bring in dollars for you. That also leads into purchasing, buying at the right price, reducing special orders and road purchasing, looking at discrepancies, looking at physician preference items, reducing shipping costs. All of these are opportunities to save your hospital money. And if you are a supply chain person on this call, this is more of a direct responsibility. But if you're in IT or you're supporting the ERP application, you have a responsibility to help the supply chain department to get this information, to be able to act upon, and to make sure that you're not a bottleneck to them getting this work done. So prioritizing projects is something that projects with savings opportunities should be getting a focus, and those more than often than not are going to be in the supply chain area. So really look at how you're prioritizing supply chain work and opportunity. And when you look at an ERP upgrade and replacement, you might be able to get much faster ROI out of them if you include supply chain savings projects as a part of that. And similarly, here's some examples of purchasing projects that you can do. Service spend, putting more spend services on contracts, mode of purchase policy, making sure that people are buying on POs when they're supposed to, optimizing your shipping costs, reducing your spend in the OR, all just examples of things that you can do. So that I want to sort of just sum up, we're looking at projects to help to improve your ERP health. A few key projects to be thinking about. First off, make sure you're on the latest version of your ERP. Unless you intend to imminently replace your ERP system, staying current should be a top priority. Documenting your business processes to make sure that they're on paper, but also that they're accurate. Far too often, that's not actually what people are doing. So, and again, if you do end up replacing your ERP, you're going to have to do that anyway. So documenting it and keeping it current should be a part of the responsibility of analysts who are part of your ERP department. Making sure you have good system architecture documentation, implementing governance, and making that governance effective, which means making sure that they're focused on strategy and that the right people are participating. Look at process improvement opportunities and opportunities to do KAIZEN workshops and use Six Sigma concepts to drive improvement in your organization, which can reduce costs, make things more efficient, and better position you to be able to in the industry. Establish goals for each department and make sure you have key performance indicators that tie to that. And the data governance is making those available and making sure that they're using them consistently from one department to the next. I didn't mention master files, but cleaning up your master files is really important to getting good data and reporting. So that's a great example of another project that is a good one that someone could probably do from home and make sure that it's making your system more effective. And again, a good example of the kind of project that you're going to have to do if you're replacing ERP anyway. Optimizing speed, speed is always a complaint that people have. Making your system faster is valuable. Implementing an advanced training program that helps people to expand their skills and become more effective users. Every hour you invest in that in IT is going to return 2 or more hours in terms of reduced support calls. That should be an easy time investment for a busy IT department. And always be planning for what's next. And that's part of the role of that governance team, to be always thinking ahead, always thinking about what's next, and keeping tabs on what's happening in the industry. So with that, this last just shows an overview of Optimum's ERP services, including software selections and a variety of other things, just so you're aware of the services that we provide. And with that, I'd like to go ahead and open up for questions. Danielle,
All right, I don't see any questions at the moment, Brian. So I'll give everyone another second to, if you have a question that you want to pop into the questions panel, we would be happy to answer that for you.
And I realize we covered a lot during this session, and so I'm happy to go into depth on any topic that would be of value to you.
All right. Oh, let's see. We got one come in. How do you implement an advanced training program when the end users don't want to learn? An age-old question.
Yes. Well, I think that honestly, it's interesting that you asked this question. I would encourage you to create a advanced certification program with your organization. Epic actually does this really well. So you'll notice that Epic has badges that you can earn by advancing your training and your skills. And I mention that because I know that many of you are Epic clients as well. And I do think that there's a lot to look at in terms of how Epic runs training and implementations that ERP could benefit from. So why your ERP vendor may not offer that. Gamify the experience of advanced training by giving people certificates, giving people different levels of success within their ERP training. So as a result, that's something that you could then tie into performance standards. You could tie into reviews, whether or not you've achieved the next level by going to a training session. So if you have a lunch and learn about geo reporting, you can have a certificate tied to attending that, and then it's much more likely that people will take the time to do that. So yeah, I hate to say that that's what motivates us, but it is. And anybody who has a game on their phone knows that the next reward is always what motivates us to continue playing. So follow that concept. It doesn't have to be hard to do. Just tie certificates or badges to every training session. You want to get people to them. And you also want to encourage them to share with each other during the sessions.
All right, great. Thank you. And David, just let you know, great suggestion. So I don't see any other ones that have come in. Oh, actually, what exactly do you apply the Kaizen process to?
So it can be anything that is a problem area, but basically you want to look at a problem that involves cross-functional teams, where you're typically not going to resolve it in an individual department. And it gives teams an opportunity to get together and put everything on the table about their challenges. So rather than these teams complaining about each other, and invoice matching is the ideal example, AP and supply chain pointing fingers at each other. Instead, in a Kaizen session, you get them together, you map out the process, you end up finding out through that mapping that people have different perspectives on what the process is. You talk about the pain points from both perspectives, and then you talk about solutions that could apply, and then agree to try something and try something different. That basic process is really a facilitation method to draw out people's concerns and help them to come to a conclusion together about something to try. Because if AP comes up with their own idea about how to improve invoice matching, the supply chain doesn't buy into it, it's going to fail, and vice versa. But if they come up with the idea together, it's much more likely to succeed. So that's a facilitation and thought process. And by taking that time and having me dedicated, saying we're going to spend the next day working through this until we have a solution, you get much more focus from people and they become much more solution-oriented rather than complaint-oriented. So that's facilitating those sessions is something that I've done throughout my career and is a regular service that we provide, something that you can bring in a facilitator to do, something you can do with your own folks. It's important that the facilitator be a neutral party, though. So whether it's within your organization or outside your organization, you can't have, to take our invoice matching example, the AP manager can't be the one facilitating that session for it to be effective. So I hope that helps to explain it.
Perfect. And then we had one more. Once an organization has decided what data to take with them to a new system, what's the best way to archive the old data?
Yeah, that's going to depend on a lot of factors in terms of what you have. And I always hate when you get that "it depends" answer. But I will say that, that you want to convert over anything that's going to drive future decision making. And you'll need to convert over master files. You want to convert over, recent general ledger information, for example. The information you're going to archive, the important thing is to make sure that that archive is readily available to people who need to be able to make those decisions. There's a lot of great solutions in that space right now, and I would archive over convert when the data doesn't need to be at your fingertips when using the ERP. So it's going to be typical that you're going to archive anything that might be more than this year or the prior year, in case of GL data, for example. But there's good solutions available. I don't necessarily want to comment on particular ones because it's going to depend on a lot of circumstances. In terms of conversion, you want to convert over anything that's going to be part of what we're going to use in the new system, and master files is the one that really stands out. Just make sure before you convert anything that you're thoroughly cleansing it so you're not bringing over your bad data to the new system.
Okay, great. Looks like that there are no more questions other than that. So
I think we're just about at time anyway.
Yep, I think we're right at the perfect time.
You want to mention that if anybody does have any follow-up questions that they have that they think of later, please feel free to email us and ask those questions. We're happy to address them for you and go into any of this in more detail at any time.
Yes, absolutely. And yeah, I wanted to thank everyone for joining today. And thank you, Brian. This was great. We will have a recording of this webinar on the website as well as our YouTube channel in the next few days as well, if anyone wants to rewatch or share that with any of their colleagues. So with that said, I think we are all wrapped up, and I just want to thank everyone again for joining our webinar today.